To another Facebook and YouTube Live. It is so good to be with you. It's beginning to warm up here in Minnesota just a little bit. So there's hope that spring is on the way. And so if you're watching this live, give a shout out in the chat. I'd love to know who you are, what state you're coming from, and just where you are making a difference in nursing education. And if you're checking this out for the first time, the goal of this live stream is to support and serve the needs of nurse educators just like you in the trenches, to empower you with practical strategies to better prepare your students for both practice and licensure. If we haven't met, my name is Keith, and I'm the founder of Keith RN. And my why or vision of what I do is to be a leader, to see the changes needed to transform nursing education, to close the ongoing practice gap between how nursing is taught and practiced that leads to better practice readiness of new nurses and better patient outcomes. And we must never lose sight that whatever happens in nursing education doesn't stay there. It's not Vegas. And so therefore, let's be the best. And it's my passion to empower you kind of with practical tools and innovative resources that I've developed, the unfolding case studies, handouts, to really help strengthen and develop the clinical judgment that our students need to be well prepared again for practice and NCLEX. And so great to see the comments coming in finally. Sophia, Dixie, and Judy from Los Angeles. We've got the Heartland and Sherry Bridges and Belinda and Kansas and Virginia, Chicago and Cindy. Thank you so much. Yeah, cold. Well, I don't know it's as cold as Minnesota, Sophia, but you're close. You're close. And so it's such a blessing to see Carol again. Carol, you're a frequent flyer, but it's always good to have you here. And Mississippi, Heather, and Edra in North Carolina. And this is the power of the internet, that we can harness it for good. Even social media, we sometimes can make fun of it because it's like, it has its faults. But you know what? If we're on a mission and if I'm going to lead a revolution to transform nursing education, I think that's for good. And we're not talking about a violent overthrow. We're just talking about realizing Dr. Benner's vision of radically transforming nursing education. As she wrote in Educating Nurses, which I have my signed copy from Dr. Benner right here. This is a must read for every nurse educator. It's 12 years old. But you know what? Dr. Benner has a vision. She had a kind of prophetic insight with her research from the Carnegie Foundation that really identified the changes we need to implement to strengthen and transform nursing education. And as you all know, I come to you live every 2 weeks. I just take an hour out of my schedule to serve your needs on this live stream. And we're going to make this a dialogue. I promise not to make this a monologue as much as we can with Zoom and with this technology. But I wanted you to know that 2 weeks ago, I had a wonderful guest, Dr. Cynthia Clark, who talked about civility. As we know, Cindy Clark is the expert, bar none, on this topic. She's written extensively, over 100 articles in the nursing literature. She's written 3 books. And we talked last time, 2 weeks ago. If you missed that, subscribe to my YouTube channel, Think Like a Nurse. Because every live stream that we do automatically goes to my YouTube and my channel, Think Like a Nurse. So if you miss it, and many of you reach out and say, you know what, Keith, can't make it, say no worries. And I want you to share the link. For those that are watching, and it's great to have a wonderful audience here tonight. And for those that are watching, and if you find this helpful, please, after this webinar, after this live stream, you can easily go to my YouTube channel, Think Like a Nurse, and download it. And so again, Cindy Clark's video, about 50 minutes, is there from last time. I highly recommend it because, as we know, academia and incivility, unfortunately, can go hand in hand. I also want you to know that I'm the admin for a wonderful community of educators in Facebook. And the admin group that I have is called Teachers Transforming Nursing Education. We've got 10,700 plus nurse educators from around the world. And so if you're not a part of this community, it's not like another Facebook group. We're not ranting. We're helping. We're supporting. We're collaborating. We're sharing our stuff. our tools, our handouts. If you ask a question, you'll get a lot of responses. And those of you that are inside the group, give a shout out. Tell me what you're finding most helpful inside this community. And if you're not a part of it, it's a closed group. It's not open to anybody. So if you're an educator, answer the questions. I'll let you inside, and I look forward to having you a part of that community. So please be sure to join me. And I do my best to respond to that and be a part of that. And Sophia says she loves the group. Sophia, what do you like? What is it that you find most helpful? And so just Michelle says she loves the collaboration. I agree, Michelle. My passion is to, I didn't always have the support that I needed as a new educator. And some of us still struggle to get that. Even in our busy worlds of academia, we're sometimes siloed. We shouldn't be. But if you are, and you just need an extra set of eyes to look at something, to share a struggle, a question, this group, there are thousands of people inside. You'll get responses within minutes. It's wonderful. And the support and collaboration, the support, and we need it. We can't do transformation alone. We can't teach well alone. We need each other. And so let's really just, again, I just love the spirit in that group, and I'm glad to foster that and do what I can. So thank you for being a part of it. I just want to let you know that I am coming out of my igloo in Minnesota. And I want you to know that this spring, I'm starting to kind of spread my wings and get out after a couple of years. As you know, a couple of weeks ago, I spoke at the GAIN conference, the Georgia Association of Nurse Educators, and wonderful. And I want you to know I'm going to be speaking at a North Dakota collaborative event in Minot, North Dakota. It's a small town, North Dakota, but you know what? I'm driving, and I'm looking forward to being there April 8th. I'm also going to be a vendor at the Minnesota Health Educator Conference here in Duluth. And so if you're listening to this and you're a Minnesotan and you're a Minnesota educator being at that conference, look for me. Say hello. I'd love to see you there. I'm also going to be at 2 national conferences as a vendor with my table, and I'm going to have my latest resources, some free goodies, and I'm going to be at the ATI Summit in Seattle, Washington in April 10th through the 13th. That's a big one. It's the first one in a couple of years. It's been kind of COVID shut things down. Well, we're opening up again, and I'm excited for that. And so be sure to check out that. If you're going to the ATI Summit, I want you to basically, let me know or throw it in the chat. I'm also going to be at the Nurse Educator Conference in the Rockies in June. That's the 15th through the 18th as a vendor. So again, if you're going to be at any of those conferences, please say hello. And I'd love to connect with you. I want to share something kind of personal with you before we jump into today's topic of looking at concepts. What concepts are most important, which really kind of aligns with what content. I'm going to share some practical strategies, some activities that we can use as educators. But I want to share something personal that really spoke to me on a recent walk in the woods. We are blessed to live next to a county park here in Andover, Minnesota, that had about 6 to 8 inches of snow last week. And I went for a walk. My spirit was tired. And I just, I put my boots on and I trudged out in the snow, and just nature refreshes. Let's just be honest. We need to get outdoors and enjoy the beauty of God's creation. And, I came across this image, and I'm thankful I had my camera because it really spoke to me. And it really spoke to me, and I hope it speaks to you in a way. But what this really, just take a moment and drink it in. You've got 2 divergent paths. You've got a path that kind of goes straight ahead to the light, and you can see only one set of footprints are on that path. You can see a diverging path to the right. Many feet went that way, going away from the light. And Robert Frost, the poem that Robert Frost, On the Road Not Taken, it's a classic. I'm not a poetry person, but this poem I love. But he closes this poem with basically, he had a chance to go on 2 paths, and he chose the road less traveled. And that has made all the difference. I want you to think about that, how that relates to our journey as nurse educators, taking the road less traveled. I want you to share your thoughts on that, because really, It's a hard road. It's the road less traveled, but it makes all the difference. And I just want to encourage you to just recognize that sometimes you feel like, you're on this journey kind of, alone at times, because again, not everybody wants to change. Let's just be honest. That's the reason we're still struggling to transform nursing education 12 years after Dr. Benner's work came out. But I'm an advocate of Dr. Benner. She's one of my heroes, and I see the need for change. I know you do too. And so together, let's change this paradigm. Let's take the road less traveled, but let's get our colleagues, let's get as many to walk towards the light, because the light that you see there is the truth. I'm not just blowing Keith RN's horn. I don't want you to follow Keith RN. I want you to follow the truth and educational best practices wherever it leads. And that's my passion. And that's what I'm committed to doing. And that's what I'm going to do this afternoon, this evening, with this presentation on concepts, and just help us guide us to really some of these best practices. And so anyways, yeah, Carol says it looks like an incline taking the high road. But yeah, so anyways, let that just minister to your spirit. And again, encourage you all to take this road that is less traveled. And so let me just kind of transition. Let me kind of take that off here, put myself back on the screen, and go back to what I want to share. And what I wanted to kind of basically preface this content that we're going to talk about tonight is that we've got to put this in context, just like we've got to put everything we teach in concept or in context. And let me just share a link with you here before I go any further. So let me just share this in the chat. This is your homework for tonight. If you have not downloaded and read Chris Tanner's groundbreaking seminal article, Thinking Like a Nurse, a research-based model of clinical judgment, this is a must read, because Tanner's article puts everything in context that we'll be talking about today. Because, Tanner coined the phrase thinking like a nurse, or think like a nurse. But what Tanner identified in her research when she did a meta-analysis of almost 200 articles in the nursing literature at that time on clinical judgment, she identified this incredibly, really kind of insightful finding, that in order to think like a nurse must care like a nurse. That clinical judgment is prefaced by the caring that a nurse brings to it. And so when we look at developing clinical judgment in nursing education, many of us are running scared from next, we're a little fearful. We're struggling with some of the just keeping our heads above waters. And now next gen is breathing down our necks. What I want to encourage you all, and I'm going to preface this presentation with this because it's going to fit into this. We need to develop holistic clinical judgment with our students. Now, that's a term that I coined. It's mine. But you can share it if you like it. But really, it's really not mine. It's just a way to kind of a metaphor to look at clinical judgment differently, because it's not just thinking like a nurse. A nurse needs to basically, in order to provide authentic and make the best decisions, you need to care like a nurse. So you need to bring care and compassion into what you do. You also need to have the knowledge base to use and apply your knowledge. And that's foundational. That's like kind of building the walls of our house, that we're building in our students, a literal house. Lay the foundation with caring, role modeling that, building with understanding knowledge, and then using clinical reasoning and Tanner's framework in the nursing process to tie it all together. Those reasoning processes of noticing, interpreting, responding, and evaluative reflecting, and how that ties together. And so I really want to encourage you all to read Tanner's article if you haven't already. And so, and looking at how we as educators can not only develop the thinking, because if we just develop the thinking like a nurse, the judgment skills, and we're focusing on, the NCSBN framework and Tanner and nursing, and we're just getting lost with just focusing on these 6 steps of the NCSBN, we're going to lose sight of the importance of making sure that our students understand essential knowledge and they also care. And so in response to that, what I've written and developed is a new series. It's a new textbook series. Many of you are familiar with. I wrote this 6 years ago. It's kind of dated, but it's still relevant. Think Like a Nurse, Practical Prep for Professional Practice. And my passion with this book was to provide a practice-based perspective of the content of nursing, the thinking of nursing, the transition to practice. And what I've got coming next month, and I'm really excited. I'm going to share some links that where you can download an excerpt of this volume of what's coming in just a little bit. But what I've written, I've taken this book and I've made it into 3 separate volumes. And the very first one, Holistic Clinical Judgment, focuses on the foundation of caring, holistic care, student success, professional behavior, and addressing incivility. It's only 6 chapters, about 170 pages. But in essence, these resources kind of align with each aspect of developing holistic clinical judgment. So at Fundamentals, this would be a great resource. I also have volume 2 I just got from the printer called Building the Knowledge Base for Professional Practice. This is where I talk about pathophysiology, talk about advanced concepts, foundational concepts. So I'm going to be talking about some of the content right here in this book that nobody has seen yet. So we're going to go into this book briefly at the end of this webinar and just show you some of the things and how I align it to help our students understand pathophysiology, but also go into pharmacology, fluids and electrolytes, practice-based nursing assessment. I took the lens of practice, and my goal is not to regurgitate prior textbook content, putting the lens of practice on it. And that's what we're going to talk about today with pathophysiology. And then I've got a 3rd edition coming called Developing the Clinical Judgment for Professional Practice, where I make Tanner's framework visible and noticeable and what that looks like. And so I just want you to know that these resources are coming. And I just thought, let me just share, I'll just share one thing in the chat that you can download while I'm talking and going on Patho. And I have basically got a chapter by chapter integration of the book series and kind of what courses they would align with for your own knowledge, because this is going to be a resource. And I'm just putting in actually the information page because I don't have the pricing and everything else yet. But the Think Like a Nurse volumes 1 through 3 is going to be a resource for faculty. Even though it's for students, trust me, faculty you will benefit from it. And I'll have some pre-publication pricing discounts coming here in about the next 2 weeks or less. We're going to start opening the door to have that purchased. And I'll have some pre-pub pricing, best pricing that I can offer. If you go to that link at the very bottom there, and there's going to be halfway through, you'll see the ability to download an excerpt. So download the sample, the Apple sample. I'm going to have 3 samples that you'll get in the next couple of weeks. So please take a look at that and putting that together. And so, Joan talks about saying, believing in caring and compassion to be intertwined with the patient experience. That's so true. Without the caring, there really isn't that reflection. And so anyways, just take a look at it. I just want you to know it's coming. But I want to dig into today's content. So I want to thank you all for taking time out of your busy schedule. And we're going to ask a question. Again, I want a dialogue tonight. So let's talk. And so I'm going to throw this in the chat. And it's kind of like, and many of you are familiar. Let me see if I can find it here. Here it is. I've got the Bible. Gideons Concepts for Nursing Practice. And as you know, this is kind of a resource that we use if you're teaching conceptually. And again, this is just the knowledge. We're kind of just reorganizing the knowledge with a concept-based approach. But again, it's information. Again, there's exemplars for each concept. But in essence, Gideon's got 57 concepts in this textbook. It's pretty thick. It's over 500 pages. One simple question. I'm a triage. I'm an ER nurse. Let's triage. Which concept of Gideon's is most important? So let's start with number one, and then we're going to backtrack, and then we're going to break it down into those supporting concepts at both the fundamental and the advanced level, and how we can effectively begin to teach that, whether you're teaching conceptually or traditionally. It doesn't matter because the knowledge is still the same. It's just organized differently when we use a conceptual approach. And again, concepts kind of simplify the content. That's a strength of conceptual teaching. So I've got the question. That's on the screen. You can see it. What concept is most important in nursing education? So I want to takes about 20 seconds to get your chat kind of into where I can see it. But I would love to see what you guys are thinking out there. Which concept of Gideons is most important to develop practice-ready nurses? Okay. And so going to give you a moment, put some thoughts out there. Kim Perry says stress and coping. You know what, our students, I think for our students and even for nurses in practice, you're so true, Kim. You know, it is a stressful world out there, and COVID hasn't helped, and life in the pandemic hasn't helped. Carol says caring. I love that. And, you know, I think they call it a little something. You do have looking to see what Gideons calls it, if she calls it caring or not. I see caregiving and care coordination, but yes, I wouldn't disagree. Chris says professional identity. Chris, I hope you're a colleague, or do you work with Nelda or her work with the PI with professional identity? And I don't disagree with that, because they've identified some pillars of, you know, the importance of the knowledge, of the ethical and values, kind of in some big picture things. Judy says critical thinking, hard to pick one. Well, I'm going to pick one just so we can keep on track and don't keep this too long. I'm going to go with concept number 38, clinical judgment. So clinical judgment is by far, in my opinion, if you don't make the right decisions, you're not a safe practicing nurse. And so I think it's really important that, yes, does caring support clinical judgment? Absolutely. And so what we need to kind of, you know, step back, I think, in nursing education is let's make clinical judgment the center of everything that we do. It's like the sun. And that's why Tanner's framework, I believe if I had my way, Tanner's clinical judgment model, which is a practice-based model of clinical judgment and clinical decision-making, that needs to be the foundation, because it's a practice-based model validated by research and evidence. You know, the next gen model, it's a test framework. It's really just only been researched to write test questions to evaluate clinical judgment. It has never been researched, not yet, for practice. So therefore, even the NCSBN says you don't need to teach the 6-step model to students. Did you know that? Unfortunately, there's a lot of confusion right now in nursing education, because a lot of prominent educators are advocating just that, though the NCSBN has never suggested it. They said use nursing process and other theoretical frameworks that you've been using. You know what the number one framework is in nursing education besides nursing process? You guessed it, Tanner's clinical judgment model. Now, does the 6 steps of NCSBN align with it? Yes, but it doesn't make it the same. And so therefore, we need to be very careful that, you know, we put the sun in the right place, clinical judgment, but then we need those supporting processes that are going to help us get there. Now, caring is one of them. The other aspect that's going to get us to developing clinical judgment is understanding essential content. And that's the premise of today's conversation, because unless your students understand essential knowledge, especially pathophysiology, they will struggle to make a clinical decision, because that's where the rubber meets the road. The clinical judgment is the outcome. So if we're going to make clinical judgment concept number one, all these other concepts need to orbit around it. And that includes caring. And actually, the bulk of Gideons Concepts do align with that. But what we do need to be very careful with is that understanding that the knowledge of the applied sciences, especially pathophysiology, is foundational to developing. On top of caring, they have to be able to use and apply knowledge. And so now we're going to kind of take it to the next step and say, okay, when you look at Gideons physiology concepts, which ones do you think are most important? When you look at, concepts, as you know, with the way Gideon and other conceptual frameworks, they're not all pathophysiologic. But for tonight, I want us to kind of drill deep, because pathophysiology lays the foundation. It is the mother of all of the applied sciences in a good way. Because again, your students won't understand pharmacology and mechanism of action if they don't understand pathophysiology. They won't understand fluids and electrolytes and all the hypos and hypers we throw at them unless they understand pathophysiology. And so let's kind of take a step back. And this is what I'm going to be talking about today, is kind of identifying what are some of the essential concepts that we want to focus on at both the fundamental as well as the advanced levels of our program. So we're kind of leveling our concept. I'm just going to share some thoughts that I've kind of thought about this. And again, you can, I'm not saying I have it all figured out. I'm just throwing this out there as my spaghetti on the wall as we look at concepts and maybe look at them a little bit differently. And so what I want to do is basically kind of just talk about some of the fundamental concepts. And beginning with, as we look at our first year students, first semester, let's just have a brief discussion about what concepts lay the foundation of knowledge and some of the exemplars that flow from it. And then we're going to do some application and basically kind of look at how we can integrate pathophysiologic or pathophys concepts more effectively, so our students are using knowledge, not just memorizing it to pass that test. So I'm an ER nurse, priority setting. I love the ABCs. So, my number one physiologic concept for fundamental students, and you guys, I would encourage you to take notes or write this down, as well as share your thoughts and see if I missed anything or what you would share, because we can't talk during this, but I can read the chat and I'd look forward to seeing your thoughts. But the very first fundamental concept we should really be drilling deep with to help our students understand is gas exchange. As you know, gas exchange is the A of ABCs. And so that to me is where it all begins. And gas exchange is complicated. Boy, do your students know the difference between ventilation problems, transportation problems of gas exchange, or perfusion problems? They're all interrelated, and it gets complicated. And so, therefore, looking at, asthma and COPD, the most common ventilation issues. You're at transportation with your blood cells, anemia and sickle cell, and perfusion issues related to shock and heart failure. Those are primarily secondary, though, because we're focusing on what's going on in the respiratory system, not so much the heart, but they both are interrelated. That needs to be understood. Second fundamental concept I'd like you to think about is acid-base balance. Acid-base balance kind of aligns with gas exchange, because if they don't understand gas exchange, the next kind of step is the ability to understand respiratory acidosis, respiratory alkalosis, and those aspects of metabolic acidosis with DKA, chronic renal failure, as well as with your ABG interpretation, which again it's kind of in the middle somewhere. But I think that acid base, it's a little complicated, but our students need to understand it. Third fundamental concept, pathophysiologic concept, is infection as well as inflammation. They're really kind of hand in hand, because as you know, infection causes an inflammatory response. And as you know, sepsis and septic shock, is really a systemic inflammatory response. That's what SIRS is. And so again, helping our students understand infection. The fourth concept I'd like us to see our fundamental students, understand is elimination. Think about it, think about your fundamental textbook, and your thoughts of just looking at the urinary system, looking at the GI system, and those aspects of problems related to elimination. The fifth one I would look at is pain, and pain control, looking at acute pain, chronic pain, understanding pain. Again, really a fundamental concept and just a kind of a way to look at that. Tissue integrity, looking at pressure injuries, diabetic foot ulcers, and anything related to skin integrity. Again, a kind of a fundamental concept, as well as glucose regulation is the seventh and final one I kind of have on my fundamental list. And looking at diabetes, looking at the hypoglycemia and why, hyperglycemia. And so again, glucose regulation aligns with that. As you look at some of the advanced concepts, I kind of consider, for your second semester or onward, perfusion is really kind of an advanced concept that really, as you look at the volume, hyper, electrical disorders, looking at cardiomyopathy, etc. Intracranial regulation, looking at stroke, embolic strokes, hemorrhagic strokes, Alzheimer's, seizures, anything those neurologic syndromes tend to be a little more complex. I also look at cellular regulation and oncology. Immunity is the fourth, a difficult concept for students at the fundamental to grasp. But again, understanding anaphylaxis, autoimmune disease, HIV. In thermoregulation, looking at the hypo and the hyperthermias. Why do you have a fever with sepsis? And again, helping our students understand the why. Because really when they understand pathophysiology and these concepts, as well as kind of closing with hormonal regulation, the endocrine system, everybody's favorite to teach. That's basically something that most of our students struggle with. And I think it should be more of an advanced concept. But I want to just throw this out there in the sense that, are you leveling the concepts for your students? If you're teaching conceptually or when you're looking at the knowledge, I think we do that more effectively in a traditional system. But if you're teaching in this way, are you leveling the concepts? That's my thought. And I just would love to get some of your feedback in the chat. And then we're going to kind of go into an example of how we can effectively teach and integrate the knowledge of pathophysiology with our concepts as well as with body systems. And so I'm going to kind of shift gears here and share my screen. But Sophia, I just got some thoughts here. Jones commented, understanding is owning. If you understand, you remember. If it's memorized, it's forgotten after the test. And Joan, you said it beautifully. And it's so true. And that's why our students must understand pathophysiology. And if we're honest, as faculty, sometimes we struggle to understand some of these higher level concepts. But let's take the effort to understand it, digest it, and then let's teach it effectively. And Sophia says, very true, just taught the concept of gas exchange, focusing on exemplars of COPD and asthma. So did you use any case studies, Sophia? Did you use, that's always a wonderful way to contextualize your content, to really bring it to practice. And that's kind of some of the things that I've done with Keith RN that educators have found really helpful. But what I'd like to do here is let's share my screen. I'm going to share with you something that nobody has seen yet. And that is basically chapter 1 of this is the first chapter of my second volume, Pathophysiology Fundamental Concepts. And so what I want to share here is I want to give a shout out to Rita Peters, who actually authored this. Rita is a doctoral educator at Heston College in Kansas. She has been teaching pathophysiology for decades, and she was able to take her knowledge as an expert faculty on this content, and she synthesized it in writing this chapter. And what she did, I'm going to just kind of share with you what I have here. This is the very first fundamental concept of gas exchange. And what I just want to share with you is kind of the structure that I've used in this book with this chapter, but then I'm going to highlight some activities, and we're going to do some activities together. So stay with me, because I really wanted to kind of bring practice into this with just need to know knowledge and do it differently than what I see in most textbooks as it relates to help bring a practice perspective. And so when Rita wrote this, she kept it really simple, and I added numerous illustrations for like adequate ventilation and talking about gas exchange. Just one or two paragraphs, keeping it simple, need to know, talking about the transport aspect of gas exchange. Let me just lower that just a little bit. There we go. And then just always has the same structure for each concept. Key terms, looking at just the basic terms that are most important, briefly defined, relevant lab tests of this concept. What labs are related to gas exchange? Highlighting the physiology with some simple illustrations, and then go into the most common problems that we see of gas exchange. So this is where if you're teaching traditional body systems, bring those out. But this is the first activity that I developed and is integrated in the workbook. And it basically is really simple. In order for your students to understand gas exchange, you want to help them. They basically have to do three things with this simple activity. They need to do they have to put the definition or their understanding of gas exchange or any concept in their own words right here. Then identify three specific problems that they see most commonly in practice or at their level of the nursing program. So let's use, for example, let's just take one of each. Let's take COPD for the first one. Let's take anemia for problem 2 right here, and then let's do heart failure for number 3. Now, with each of these problems, they now take the concept of gas exchange. The problems are identified here. Now let's take the pathophysiology of COPD, physiology of anemia, pathophysiology of heart failure. And what we're doing with this is helping them see the connection between the concept definition and what's similar, what's different, a compare and contrast. Now, if you like concept maps, you could take this linear table and make a concept map, putting gas exchange or any problem in the middle. Oh, is they saying, oh, you can't see my screen? Oh, no. Can you see my screen? Somebody put that in there. I thought that you should, my screen should be visible according to my technology. And let me try this one more time and make sure that I was hoping that we could see it tonight. So let me try one more time. All right, tell me if you can see the book screen. I'll just kind of highlight here and not seen it yet. That's at 3822. Shoot. Let me just try something different then. How about if I do this? I'm going to go full screen. Let's try this one more time. We're just going to go entire screen. I'm just going to go like Texas, go big or go home. Let me just, okay, let's try that. We're going to go, boom, one moment here. Okay. And share the entire screen. We're going to go boom. And let me just do this. And tell me if we are still unable to see this or not. And just put in the chat. I'll wait about 20 seconds. I apologize for this. Sometimes technology doesn't play well, and we'll get through this regardless. I just, if nothing else, I'll share the link to where you can get the excerpts from volume 2, but I was hoping to show you this, and so I apologize for that. But tell me if you're able to see if you're able to see the book on the screen, and let me know either way. So let me just, I'll go to, I cannot see screen, so Carrie, so no, not yet. Okay. Well, you know what? That's okay. You know what? Technology is not always going to play well. and that's okay. But we're still going to get through this presentation, and it won't be a problem. So let me just kind of go back here and go right here. No worries, guys. We'll just kind of I'll have to contact customer support and go from there. But what I do want to share is that let me just kind of just one of the things that I do have that is basically looking at one of the things that is a worksheet that I've developed that's in the book. And you can basically there's 6 questions using pathophysiology to help your students understand how it connects everything together. And so this is in the book, actually, by the way. This is also a handout that's in my membership platform, Think Like a Nurse, where I've got tools for educators, not just case studies, but one-page handouts for clinical, for classroom. This is one of them inside the membership. And so I'm going to share with you, it's also in the new book. But these are 6 questions that you can ask your students. And if I had the book this working, I could easily just kind of show you some of the show you what yeah, that still bothers me. I'm just oh, that's too bad. Oh well, another day. But the first question is this. There's 6 questions you can ask your students for any problem or concept to help them understand pathophysiology connect. The very first question: what is the pathophysiology of your patient's problem, or what you're teaching in the classroom? So this can be used in the classroom and in the clinical, in your own words. So if you have a patient with heart failure or with a gas exchange problem like we just were talking about, COPD, explain COPD in your own words. That's question 1. Question 2, how do you teach pathophysiology to your patient? So if this is a new diagnosis or they're just not really familiar with what this problem is, how do you basically teach it? How can you bring the knowledge down from the textbook and your understanding and synthesizing in your own words to teach it to family or the patient? That's question 2. Question 3, what body system is primarily impacted by COPD and how? So again, it's obviously respiratory, but then talking about how does it affect the lungs, the alveoli, bronchioles, and what is affected and how? 4th question, what are the priority assessments that you'll do as a nurse with a patient with COPD? And so therefore, get specific. This is where you can bring clinical to class. If you're doing this in the classroom, and this could be a great ticket to class, by the way. So if you have access to this resource or would just like to write these questions down, and Melissa says she's using this, developing critical thinking. Yes, that's it, Melissa, with your students in clinical now. So Melissa, and I'd love to know, since you're watching this, how is it working? What are your students finding? Are they connecting the dots? I'd love to just get your thoughts and your feedback when you get a chance. Carrie says, I love having them teach it to the patient. All healthcare providers need to work on that. I agree, Carrie. But again, we need to understand pathophysiology to teach it. Our students are like educators. If they don't understand it, you can't teach it well. That's the same for us as well. So it's really beholden to understand. So after the body system is impacted, question 3, question 4, what are the specific assessments and that you're going to do? So how are you going to assess the lungs? You're going to just assess it on the upper lobes, the middle, the lower, the lateral? What about their O2 sat? What other things are you going to be paying attention to? Great questions to do in the clinical setting. And then what are the expected abnormals? That's a good question for an advanced student because, again, fundamental students are just keeping their heads above water. Keep it simple. If you're going to use like this worksheet with your fundamental students, focus on the pathophys in their own words, how you're going to teach it, how you're going to do an assessment with this problem. That's about it. But then we can scaffold it and go a little more intense semester by semester. So again, expected abnormals. That's really important because of ambiguity. Not every patient is going to have the same presentation, but Is it normal to have diminished breath sounds? Is that textbook normal? No. But is it normal with a patient with COPD? Absolutely. And so, again, making those distinctions like that is a higher level skill, but our advanced students need to be pushed. Let's push it and move that chain forward. Fifth question. What lab values are altered or are expected abnormals as a result of COPD? What about what about on their basic metabolic panel? What about something called their CO2, which is really their bicarb? Is that going to be elevated or is it going to be low? And if it's elevated, why? Again, if they understand the fundamental concept that we talked about of acid-base balance, they'll recognize the why. Is my bicarb elevated? So again, I want you to see how these physiologic concepts are foundational to developing this higher level thinking. And then finally, the sixth question, what medications do we use to manage COPD? We have the albuterol, we've got the Advair, et cetera, the prednisone for severe COPD. Why? What's the mechanism of action of prednisone, of albuterol, of Advair, et cetera? And how is that going to benefit the patient? You see, when they understand their pathophysiology, the pharmacology connects, they're able to connect the dots. And so in these 6 questions, physiology and pathophysiology lays the foundation, but you can see it intersects. It's like a spider web of pharmacology, nursing assessment, patient education, lab values. It's foundational. And so I just want to encourage you all as educators, make pathophysiology the foundation of your critical thinking, because really understanding knowledge is really the best definition of critical thinking in the literature. And it came from Potter and Perry, Fundamental of Nursing. From the mouth of babes comes wisdom for nurse educators as well. It's that understanding the knowledge. That's where we need to strive towards in our classrooms. So let's make our classrooms interactive. That's another discussion. We're not going to go there tonight. But this simple worksheet can be used in classroom as a ticket to class. If you're teaching on any of these concepts that are pathophysiologic or doing a body system lecture in a traditional system, no worries. Have them do 3 of these questions. Come to class prepared. Post this worksheet ahead of time. And then come and then discuss it and then build on it. In clinical, make it a supplemental activity to your clinical paperwork. It's relevant. Every one of these questions will strengthen. And it's repetition. It's that repetitive practice. And that knowledge is going to translate then when they leave your programs. They'll understand, they'll make it a priority to understand pathophysiology every time they care for their patient. And so, yes, Melissa says, I've seen such a difference in students making the connections from theory to practice. How to teach a patient is a student favorite, because it takes it out of theory and into practice, gets them practicing patient education, which forces interactions and answering questions. Thanks so much, Melissa. So it's a real encouragement to know that the resources that I've developed are helpful. And again, they're not rocket science. I just happen to be a nurse educator who never left the bedside. And so I just took my lens of practice and made it practical using the principles of Dr. Benner, Chris Tanner, laying a foundation of educational best practice. That's really my value proposition. That's kind of the essence of what I do. And it's such a pleasure to serve the needs of educators. And again, help bring practice kind of front and foremost again. Yes, we need to pass the NCLEX, but again, let's basically kind of put first things first and remember that everything that we are teaching our students needs to align with practice readiness. And so again, I just want to share, I'm sorry that I wasn't able to share the excerpt that I had that Rita Peters worked so hard on. And but again, you know what? If you again go to that information page, just know what's coming. It really is going to be a powerful and practical resource. And I'm just really excited to have something different, because what I've done with it as well, with every concept, I have a case study. I have a concise case-based scenario that is in essence brand new, but emphasizes the reasoning and basic application. So again, one of the paradigm shifts from Dr. Benner was basically to contextualize our content. And so when I wrote these series in the second volume, I really took the knowledge, put a lens of practice, need to know information, and then connected it to practice immediately. And if you notice, I didn't wait till the end of the book to do that. I integrated that throughout the chapter and throughout each section. So it's not like end of chapter activities. Nobody does those. I'm doing them during the reading, having them pause, reflect, and be able to then, engage with the material as well. And so Judy asked, when are the volumes going to be ready to purchase? Those are going to be ready to be purchased in about 1 to 2 weeks, Judy. I'm looking at getting those posted, working with, I've got the third volume on clinical judgment skills is basically going to be coming out. I'll have it in my garage in about 3 weeks. It's still being laid out. And so I don't have all 3 editions. I want to just do one shipment. You can buy these books separately. They can be adopted separately. My goal for this resource is really twofold. Number one, I want to get it to educators. I want you to be the first to have it because I want you to see the value. That's why I'm going to conferences and trying to hit some national events and just get the word out. And again, I'm not pushing this. I just want you to know that if you're looking for something simple, and one of the things that I want you to notice, this is the volume 2, that's 6 chapters. It's 3/8 of an inch, 180 pages. So it's not like a lightweight, like it's just a little workbook. But what I've done with it, and I just want to show you really quickly, you can see it. I got wide margins on the outer edge, so you can write in it. I want this to be a work text for students. I also want you to see some of the icons and the images that you can see. Let me just, if you look at the top here, since I couldn't show this on the screen, you can see I got like a key takeaway. And I've got another, so I'm highlighting for students just aspects of what's most important for them. So they pause, reflect, don't just read this like a textbook, but engage with it and interact. And so the other one that I have, that other link, is the integration of each volume. So I just want to give you all a vision. If you like this book, when you get it, I want you to know that, it's going to be coming out in an interactive ebook as well that they can take notes in. They can download it as a mobile app on their phone, have some very high level interactivity that's going to be more than just a Kindle, more than a PDF, which was my last book. So I'm going to try to do my best to step it up. And so again, take a look at this resource and go to the information page. Just learn more. My goal is just to kind of, just share it, take a look at it, and I value and look forward to your feedback. The last thing I just wanted to share in closing tonight is just wanting you to all know that, this book is a student-centric resource, but I also have a membership for educators. And, my passion is to help educators develop and teach clinical judgment, practice readiness, and just using tools that emphasize Tanner's framework. My case studies developed that 10 years ago. And Tanner's is now the essence of next gen. And one kind of secret thing I want to show you here in closing is this powerful infographic from ATI. What I want you to notice is this. Tanner's framework is on the outer line, outer circle, the noticing, interpreting, responding, reflecting. Nursing process is in the middle. You can see how noticing aligns with assessment. What's in the very center is the next gen framework. What I want you to see, and this is really important, is that Tanner's framework aligns with not only assessment, but also recognizing cues of next gen. So what I want to encourage you with is that you don't, if you emphasize Tanner's framework, the next gen aligns with each process of Tanner. And our students don't necessarily need to even be taught the next gen framework. This is something even the NCSBN has said is for students or is for faculty and not necessarily for students. And so I just wanted to kind of show that to you. And I just wanted to kind of highlight that ATI does have a wonderful resource that I want to share with you, Faculty Guide on Clinical Judgment. And you know what? I would just like to, that infographic is in this document. So if you like that resource, please take a look at that. But I want you to know that the membership the case studies that I've written, the tools align with Tanner's framework that aligns with Next Gen, but not the other way around. Because again, we don't need to teach to the test. We can teach to practice. And that's where Tanner's framework and its alignment, I think we should put first things first. That's the way I see it, but not everybody agrees with me. And I'll stand my ground, and I have my reasons. But I just want you to know that Tanner's framework is embedded in my open-ended questions and the case studies, the other tools. I also have about 20 hours of webinars inside the membership platform. So again, if you're not a member, I encourage you to take a look at it. I've got departmental access that if you would like a quote for your department, I offer volume discounts for the membership, and you can access over 110 case studies, dozens of tools, dozens of webinars that are just simple webinars that just kind of takes the essence of what I'm sharing in these Facebook Lives, but make it concise and help you to really use the tools successfully, be empowered to develop clinical judgment. We've made it way too hard. We've made everything, I think, sometimes a little more difficult than it needs to be. And so I just want you to know that these tools are here. The membership is one of the only, I think it's the only resource that has the tools for faculty. So it's my pleasure to provide that for you. And I also want you to know that if you're a member, I offer office hours every Friday that I'm available and not out of town. And tomorrow I will be having office hours from 10 a.m. to 12 noon. If you're a member, you should already receive a link. You'll receive one in the morning, or you may have already received it. Come onto my Zoom chat and we'll talk. And if you have questions and you just want a personal dialogue, that's my heart, is to be there for you, to serve your needs in nursing education. So tomorrow morning from 10 to 12 noon, I'll be there in my Zoom office here in my home office in Andover, right what you see here. And I hope to connect with you. If you're a member and you have questions or just want some information or just want to remove a splinter from your brain, I'm here for you and we'll discuss it together, and glad to help. So I wanted to just let you know in 2 weeks, I will be, if you have any questions, I should put this on the Zoom. I want to kind of make it very clear that I am here for anybody who has a question. So again, this is that's my website. I don't want that, though I do encourage the website. Take a look at some of the articles and blogs and other resources on my website, Keith RN. But more importantly, here's my email address. If you are having a challenge or a splinter that you need removed, send me an email. I will respond to that within a day. I'll do my best, and I'm available to help you. And I really want to see us all as educators, collaborate, work together, and I want to help you and serve your needs and make a difference and get us to help strengthen practice readiness and clinical judgment skills of our students. And so that's my email. Stay in touch. Next Facebook Live, we'll be talking in 2 weeks about practical strategies to teach and apply physical assessment and how to help our students interpret their assessment findings. One of the things that we struggle with in nursing education is infobesity. We're teaching way too much information. That includes how we teach physical assessment. Did you know that in one of the recent studies, and I'll cite this and we'll talk about it next time, we typically teach between 100 and 120 assessment skills in the course of our program. And you know how many we use in the course of our careers? 95% of the time, about 20 to 25. And so again, we don't have to teach over 100. Let's teach the 30 that they need to know. And that's what we'll talk about next time. And so what are those need to know physical assessment skills? So look forward to a dialogue, look forward to connecting with you then. And just want to thank you for all that you're doing to be part of the needed change in nursing education. It's my pleasure to partner with you, and I look forward to connecting with you in 2 weeks. Blessings to your day. Have a great upcoming weekend. You deserve it. Get some rest. Thanks so much. Have a great night.